So my name's Sarah Todd. I'm Patient Experience Manager at UHDB. So what I'm going to talk about today is our Patient Experience Champions model. So I'll get straight on with it. Just to give a bit of context first, before 2014, Derby hospitals didn't kind of leading on patient experience. So when the new director came in, a new team was set up and I was brought in as manager for that team. And one of our first tasks really was focused on the friends and family test rollout. So it had already been introduced in inpatients and A&E, and so we had quite a mammoth task of introducing it to children's, outpatients and day case services. Next slide, please. And what we learned from that really was that having to engage staff on something that's nationally driven, it was a national target, it can be quite disengaging. It's not very exciting to get staff engaged in. And one of the other big learning points for us was relying on sort of the hierarchy of the organisation as well. So liaising with senior nurses and managers and lead clinicians. We realised that we weren't necessarily getting to staff on the front line. So we reflected that it would be good to have more of a bottom-up approach to staff engagement and promoting good patient experience. Next slide, please, Helen. So in April 2016, as part of Patient Experience Week, what we did is we launched the concept of Patient Experience Champions. And we actually deliberately didn't set out a role description or a list of tasks that we expected of them. What we wanted is people we could link in with who could be kind of our eyes and ears out in the different departments. People could then link in with us to get support with different initiatives. So we kind of sell it to staff on the basis that what you're signing up for is a networking opportunity, the chance to share best practice with people across the organisation, and they also get early access to support from us, such as our Go For It fund, which has been a huge success. We offer quite a generous amount of money, 2 competitions a year. It's open to any staff, but our champions do get early dibs on applying for that. And it's basically funding the best innovative ways of improving patient experience, particularly if they need a little bit of equipment in the first instance to get their projects up and running. Next slide. So more recently in 2018, we had a big merger of Burton hospitals and Derby teaching hospitals to become UHDB. Obviously, as part of that, staff engagement was really important, and there was a lot of change across the organisation. And what we wanted to make sure was that we got really good representation at our other sites. And so we've actually ended up with close to 1,000 champions across all 5 sites, and that's continuing to grow as we continue to take on different services at different satellite hospitals as well. What staff say to us about becoming a champion is it makes them feel more connected with, especially being such a big trust now, 5 hospital sites as well as community services as well. It's quite spread out, it's quite a big geographical patch as well. So bringing people together has been really integral to making that a success. Next slide. In terms of who our champions are, you might not be able to read this very well on the screen, but this chart shows the proportion of different roles that are represented amongst our patient experience champions. So you can see some of the bigger groups there. We've got nurses, we've got medical staff, clinical support workers and healthcare. We've even got some scientists, students. Quite a lot of students sign up when they join. We've got some volunteers as well. We feel it's really important that they feel part of this. Discharge support officers, facilities staff, porters, hostesses, receptionists, administrators, therapists. Basically any role you can think of, we've got at least one, and we tend to have several across the different sites. So it's really good representation amongst our champions from all different specialties, all different roles, across the whole trust. Next slide. We wanted to share a video with you, but it's a little bit long, so we're happy to send a link out later. But we actually filmed all of our champions holding up I am the patient experience, so that you could visually see all the different people in their different roles. So we filmed very short films of them doing their roles in practice and holding up the I am the patient experience, emphasising that they've all got that role. Next slide. What we actually do with our champions then, we tend to hold formal workshops as well as more informal ideas cafes. These tended to be held every other month. Of course, COVID, we had to stop face-to-face for a while. And what we did is we tended to rotate across the different sites to make sure it was accessible to all those different teams across the organisation. Not expecting people to travel to just the biggest site, because it's only convenient for staff that are on that site. Obviously, as part of COVID, though, we had to stop doing our formal workshops, but last week we actually held our first ever virtual workshop using Teams, and it worked really, really well. We had so many people dialing in, and from all the different sites as well. So it's proven to us that actually this is a really good option going forward to make it even more accessible for our staff. And we had a really great talk from our Chief Operating Officer, reflecting on what was done as part of COVID, managing the pandemic early on, and then looking ahead to the winter, what plans are in process for that. So getting our champions to connect with senior leaders in the organisation, the workshops form a really good way of doing that. And what you can see on this slide, some of the other talks we've had in the past, we tend to have a specialist topic at each workshop. We've had dementia, prisoner health, mental health, transition from children's to adult services. We've run a deaf awareness session, and they're all really well received. And the great thing about it is we'll let our champions know what's going to be the topic at the next workshop, because then they can decide, is this something I'm really interested in, and then decide to join. So it's very flexible for our champions. They can be as involved as they want to. As part of every workshop as well, we have an over to you session, so that the champions can raise any concerns they might have, any things that they think could improve patient experience, get the chance to share ideas with other departments as well. Next slide. The other things we do, so our champions get early invites to events that we're running, as well as early access to the Go For It fund. So Patient Experience Week every year, we try and have a big celebration. Lots of events running every day, and so our champions get early invites to that. We send them newsletters as well to give them exclusive updates on things that are happening, different initiatives we want to promote. We're quite active on Twitter and Facebook, so that we can keep communicating regularly with our champions, and they get regular emails as well about anything that they can get involved in. Next slide. So here you can see just some samples of some of our newsletters. So you can see there's lots of different topics that are covered on these. The last one there, the third one along there, that's the one that we did in the run up to Patient Experience Week. So we had a whole programme of events, including lots of arts. Pets as Therapy volunteers were going to be going out. Very sadly, we had to cancel all of that. But we're holding a virtual Patient Experience Week in October that, again, our champions will be invited to join different things. Next slide. And here's just some sample tweets, so you can see the kind of thing that we put out on social media. We have a really good connection with our arts team, which is really great for staff as well, because that's important for promoting staff wellbeing as well as patient wellbeing. Next slide. So what we think we've seen really is that we've started a bit of a movement at UHDB, and we think the evidence of that is that we're seeing a massive increase over time of staff contacting us, asking for support with different patient involvement and patient experience improvement initiatives. The workshops and ideas cafes, we've had increasing attendance at those, and getting more and more attention on social media as well. So our patient experience champions seem really well engaged now. Next slide. Just some tips to sort of finish off with, really. The key thing we learnt right from the beginning is don't give them a role description. People want, when you're asking them to sign up as a champion for something, they want to know what's required of them, what are they going to be committing, and we tell people straight away there isn't a commitment that we're asking from them. It's very flexible. Be as involved as you want. Initially, all you're agreeing to is to join an email distribution list, and you'll get notices about things you might want to get involved in and get the invites to the workshops and so on. And also, you can't underestimate the importance of providing the basics. If you're doing something face to face, at least bring some refreshments. It really helps. It makes a difference. It might be the only break that staff member's had that day, that only chance to sit down and have a cuppa. So don't underestimate the basics. And just to finish up, last slide. I think it's the last slide. So the future plans, we intend to involve our champions quite a lot in the rollout of our new engagement framework. And as part of that, we want to look at a carer's passport and promoting our information and support hubs, which are intended for patients, families and staff, and they're across all 5 hospital sites. We're developing an engagement toolkit as well, so that our champions can be more equipped with engaging with their patients, involving them in service redesign. And right as COVID hit, we were all ready to start recruitment of patient leaders who would be key representatives from our communities involved in different service improvement initiatives. Unfortunately, that had to go on hold, but we're planning to reinstate that later this year. And we want to also increase the ways in which we share patient feedback with our champions. Again, because of COVID, we had to put it on stop moment for a while, but we share regular patient stories, so we intend to ramp that up a bit with our patient experience champions. And that's me.